Justice Sotomayor?
On that last question, because that did trouble me, but the reality is, even if there is some increase in emergency room visits, the question of when that rises to a sufficient safety risk is up to the FDA, correct?
That's right. And, FDA acknowledged it, so it's not like it overlooked this aspect of the studies. I also want to emphasize, Justice Sotomayor, that the studies were far from the only evidence FDA consulted. At the time it acted in 2021, it had real-world experience during the COVID-19 pandemic, a period of time when the in-person dispensing requirement was not enforced, and FDA started by looking at, as a comparative analysis, the two periods of time when you had in-person dispensing and when you didn't, and saw that there was no relevant increase in serious adverse events or difference between those two timeframes. So that further supported the safety conclusion.
The problem with all drugs is there are complications in virtually all of them.
Yes,
and at what level the cost-benefit analysis tells you to stop prescribing something is a very difficult question, isn't it?
And that's a question that Congress has entrusted to FDA.
But putting that aside, here, whatever the statistical increase was, FDA determined under the REM standard that it wasn't sufficient to create a risk that counterbalanced the need for access, correct?
Correct, because FDA is instructed to take into account burdens on the healthcare delivery system as well, and it looked at a variety of sources of data to conclude that on balance, the burdens were suggested that it was not necessary to keep this restriction in place to ensure safe use.
Thank you.